There's one thing the 2016 presidential candidates can agree on. That is the need to change healthcare in this country. In this presentation, I will discuss and dissect the healthcare platforms presented by Bernie Sanders, Hillary Clinton, and Donald Trump in an attempt to deduce which plan is the most feasible in curbing the exorbitant healthcare costs Americans pay every year. On her website, HillaryClinton.com, Ms. Clinton proposes to keep the changes made in the Affordable Health Care Act, but build upon them and tweak some of the most divisible and unsuccessful aspects of it. Clinton has long been an advocate for universal health care. She was instrumental in creating the Health Security Act that was defeated by Congress in 1993 during her husband's first term in office. The Health Security Act was very similar to the ACA. It mandated that every citizen and legal resident buy health insurance. It capped the amount health insurance companies could charge for deductibles and max out-of-pockets. It also would have expanded Medicaid. Though Clinton was unsuccessful in getting her bill to pass through Congress, she was successful in creating the Children's Health Insurance Program, which now provides health coverage to more than 8 million children. Now that Clinton is running for president, she has focused in her efforts to improve a system that she has been an advocate for nearly 20 years. Namely, she wants to continue to curb the out-of-pocket cost health insurance companies are using to increase their profits. She is also promises to crack down on rising prescription drug prices and hold drug companies accountable so they get ahead by investing in research, not jacking up costs. As discussed on her campaign website, Clinton plans to provide enhanced relief for people on the health insurance exchanges and provide a tax credit of up to $5,000 per family to offset a portion of the excessive out-of-pocket and premium costs now available through the exchanges, so that those not eligible will pay less than a percentage of their income than under current law, and ensure that all families purchasing on the exchange will not spend more than 8.5% of their income on premiums. The current law is set up so that the percentage is at 9.5%. Clinton also promises to fix the so-called family glitch. The family glitch occurs when a person who has access to job-based coverage cannot afford the family plan their employer offers because there is no limit to what employers can charge for family plans. Anybody, including spouses, that have access to job-based coverage is not eligible for tax credits on the marketplace. This leaves some spouses, particularly those that work in the home, in the impossible situation of either paying well over 9.5% of their household income for coverage or illegally going with health insurance. Though Clinton doesn't expand on how she will fix the family glitch, one simple fix would be to also limit the amount employers can charge for family coverage. Another major flaw in the ACA that Clinton promises to fix is connecting people to assistance to better understand how this whole system works. Even former Health and Human Services Secretary Kathleen Sebelius has been quoted as saying the ACA rollout was terribly flawed. The website didn't work. There wasn't enough boots on the ground to answer questions about a very complex program. Even today, 5 years after the passage of the ACA, and in year 3 of open enrollment, there is still much confusion about what the ACA even is and how it impacts everyday Americans. Clinton promises to invest $500 million per year in an aggressive enrollment campaign to ensure more people enroll in health insurance and understand their benefits. Finally, Clinton promises to curb the exorbitant prescription drug prices Americans are forced to pay. Again, she doesn't divulge exactly on how she will do this. Bernie Sanders, on the other hand, advocates for a universal health care system a la Canada or Great Britain. Under Sanders' plan, which he calls Medicare for All, everyone would have access to universal health care through a single-payer system. His argument is that universal coverage ensures that everyone, rich or poor, has access to the health services they need. Unlike Great Britain's National Health Service, where the government owns and operates the public hospitals and employs the staff in those facilities, Sanders' plan would be more of a form of social insurance similar to what is found in Canada. Under Sanders' plan, private practitioners could still provide care, but everyone would be covered by a national health care plan. As discussed on his campaign website, feeltheburn.org, this allows for private delivery and public financing to ensure guaranteed health care for all and effective cost control. It's very similar to how Medicare is delivered to Americans over the age of 65. To pay for this, Sanders would amend the tax code to create the American Health Security Trust Fund, which would be financed by various tax revenues, credits, and subsidies. Sanders acknowledges that initially setting up a single-payer system would increase taxes for the majority of Americans, but he argues that these costs would be recovered quickly by controlling out-of-pocket costs. This would be possible because the government could negotiate a fee schedule, much like it already does with Medicare. Sanders cites economist Gerald Friedman on his website, saying that by ridding citizens of the middleman, the private health insurance companies, and putting price limits on pharmaceuticals, American citizens could save $1.8 trillion. To those that argue that they do not want a public option because they are healthy and shouldn't be forced to pay for another person's health care, Sanders argues that taxpaying citizens are already footing the bill for other people. That's the nature of the private health insurance system. It's the pooling of a group of people's insurance to fund the group's health needs. If a sick person doesn't have health insurance, taxpayers who are already paying for their own health insurance are often on the hook for that person's health care costs as well. Sanders argues that his plan is actually cheaper in the long run because the cost incurred by a patient will be negotiated by the government, and then those costs will be offset by a larger pool. Sanders' plan would dismantle the private health insurance industry as we know it. His plan would end profit motive. He claims that his plan would address the huge amount of money wasted on billing and administration. However, as anyone who has to deal with the feds knows, they are waist deep in bureaucracy and administrative inconsistencies. As discussed in the John Stossel video, single-payer systems such as Canada's have the potential of increasing wait times for treatment and lead to inconsistent healthcare outcomes. Sanders does propose dramatically increasing mental health care funding. Under his plan, mental health care would be an essential health benefit, which does make sense since most physicians can agree your brain is indeed part of your body. Sanders also speaks in length about how he would tackle rising drug costs. In the past, he sponsored the Medicaid Drug Fairness Act, which makes manufacturers pay a rebate to Medicaid when prices of generics increases at a rate steeper than inflation. He has also introduced the Medical Innovation Prize Fund Act, which creates a medical innovation fund that would fundamentally restructure the system of financing research and development of new medications, as well as drastically reducing the cost of these medications. According to Ballotpedia.org, on May 14, 2016, Bernie Sanders called on Hillary Clinton and Donald Trump to join him in supporting the California Drug Price Relief Act, which would prevent the state from paying for prescription drugs at a rate higher than the U.S. Department of Veterans Affairs does. While Clinton and Sanders are pushing to bring the U.S. closer to public option, presidential candidate Donald Trump is campaigning to fully repeal Obamacare. He plans to allow free market principles to restore economic freedom and certainty to everyone in this country. He claims that by following the free market principles to create public policy, he will broaden healthcare access, make it more affordable, and improve the quality of care available to all Americans. Trump's main sticking point is the individual mandate. As described on his website, donaldjtrump.com, no person would be required to pay for insurance unless he or she wants to. He is also an advocate for health savings accounts. Under his plan, HSAs would continue to be tax-free and allowed to accumulate. However, He argues that accounts would become part of the estate of the individual. He proposes to require price transparency from all healthcare providers so individuals would be able to shop for the best price in town. However, not addressed in this proposal is the current physician networks limiting consumers' ability to shop around. Interestingly, for a Republican candidate, Trump's plan would effectively expand Medicaid. Without providing much detail, he does propose making sure that no one slips through the cracks simply because they cannot afford health insurance. On his website, he states, "We must review basic options for Medicaid and work with the states to ensure that those who want health care coverage can have it." In addition, Trump proposes block granting Medicaid to the states. Block granting is a fancy way of saying that he would defund Medicaid. According to Kaiser Health News, because Medicaid is an entitlement program, everyone who is eligible is guaranteed a spot. The federal government, which pays for nearly 60% of the cost, has an open-ended commitment to help states cover costs. In return, it requires them to cover certain programs, or groups of people, and to provide a specific benefits. For example, children, pregnant women who meet specific income criteria, and parents with dependent children must be covered. A block grant would effectively end this open-end approach and provide states with annual lump sums. States would be freer to run programs as they wanted, but states would be also responsible for covering costs beyond the federal allotment. Trump, however, claims block granting Medicaid would incentivize states to seek out and eliminate fraud, waste, and abuse. Finally, without citing sources, Trump argues that under ACA, the U.S. government is spending some $11 billion to provide health care to illegal immigrants. Curiously, under the current law, the ACA does not provide health insurance to illegal immigrants. Trump's proposal is so light on details it is hard to know exactly what he is trying to fix with this statement. Trump does not openly state this position on this matter, but if he keeps in step with traditional Republican values on this issue, then he would not be in favor of this way of thinking. In conclusion, Hillary Clinton proposes to fix the less favorable aspects of the Affordable Health Care Act. She plans to cap prescription drug costs, lower max out-of-pockets, and fix the family glitch. Bernie Sanders' proposal replaces the Affordable Health Care Act with a single-payer system. He argues that his plan will eliminate wasteful billing and administration by replacing it with government bureaucrats. Finally, Donald Trump proposes completely repealing the Affordable Health Care Act, but is very light on details regarding exactly what he will replace it with and has yet to produce any policies. The election of 2016 will be an interesting one indeed. My name is John Armstrong, and thank you for listening to my presentation.